Hey, hello everyone, and welcome to yet another To Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the To Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com. Do subscribe to our YouTube channel, and you can follow us on other social media like Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the To Talk, I have Dr. J Prithiviraj. To give you a brief introduction about Dr. Prithiviraj, Professor Dr. J Prithiviraj has a rich clinical and teaching experience of more than 27 years. He obtained his orthodontic specialty MDS from the Annamalai University, India in 1991. He had his further orthodontic training from John Radcliffe Hospital, Oxford, United Kingdom. He has been a postgraduate guide and has lectured in various national and international forums. He worked along with his father, Dr. C. Jayaraman, at the Dr. G. Chitrambalam Dental Clinic and Orthodontic Center, Karur, from 1991 to 2012. He has been teaching at the VMS Dental College, Salem, in India. He has also worked as a faculty in the Department of Children's Dentistry and Orthodontics, University of Malaya, Kuala Lumpur, and has also headed the Department of Orthodontics, Faculty of Dentistry, Malacca Hospital, Malacca Manipal Medical College, Malacca, Malaysia. He has published a book, Manual of Retainers in Orthodontics. He has, to his credit, MFDS CPS conferred by the Royal College of Physicians and Surgeons, Glasgow. He is also the first person to launch and practice the all-new advanced Smile design appliance in Malaysia. He is having his private practice in Bandar Sunway, Malaysia. The American Association of Orthodontists has nominated him as an ambassador, American Association of Orthodontics representing Malaysia. He is an active member of the Indian Orthodontic Society, World Federation of Orthodontics, and the American Association of Orthodontists. Sir, thank you so much for joining me today in today's To Talk with Your Dentist conversation, and a warm welcome to you.
Thank you very much, Dr. Rekha, for inviting me to this wonderful program which you have been doing. I've been going through your website, and you have been doing a very fantastic job. It is very useful for the patients who have got all these basic doubts. So they needn't go to the dentist to find out about these small basic doubts. So instead of going to the Google search and then finding here, you have number of specialists from particular specialty. They come and explain to the doubts, which the questions you are asking, which is basically the patient's basic question. So definitely it will be very useful for them. So wish you all the best to you. You are doing a wonderful job.
Thank you, sir. I should thank all of you, sir, all of my seniors, sir, who have been so supportive of this entire initiative. I think without all of you people coming and talking and sharing your experiences, this would not have been possible.
Yeah, it's a pleasure. It's a pleasure sharing our, knowledge with whatever, with with you, and you have to you. It is reaching the patient. So we are delighted about that. Thank you.
Sir, so you have such a rich experience of almost 30 years into orthodontics, which is basically clip treatment or putting braces. So I think most of our patients today only think an orthodontist's role is only correction of teeth or teeth straightening. So what do you think? What do you think, sir, is more important in the sense, like when the child is growing up, during the growing years, when the entire facial jaw structure is being formed, does the role of an orthodontist start from that point itself?
Yeah, we always believe prevention is better than cure, right? So the malocclusion, whatever we call it in orthodontic term, malocclusion, like proclination of the teeth, crowding of the teeth, proclination of the jaw, all those things we call it as malocclusion. So all those things is before it comes, if we can notice earlier, we can try to avoid in few things. So one of the important things that we noticed earlier that can cause malocclusion is abnormal pressure bits. right? That is all these abnormal habits like the child will have the thumb sucking, the mouth breathing. These are all normal during the children. But over a period of time, this age, when the child grows up, this habit has to be controlled. So if the habit not yet controlled, if it persists to the adulthood, then only the malocclusion comes into this one.
Comes.
So it's better we see the child, if at all the patient's parents see something abnormal, like the child doing the lip biting, sucking the thumb, sucking the finger, mouth breathing. They sleep with the mouth open. All those things because they cannot breathe through the nose. It's a habit. They have developed the habit. So if the parents find all those things earlier and they bring the child to us, then we can correct the habit, thereby preventing malocclusion.
Sir, what do you think is approximately the age that parents should take note of these habits they think will be causing the damage at that point? Like you said,
So
these habits
usually,
are normal.
yeah,
These habits.
usually these habits are considered normal till the age of 5. Once it continues after the age of 5, say about 6, 7, then the parents should consider it seriously, and then they bring the child to the orthodontist to see what exactly is happening.
Okay. Okay, so sir, if this these kind of habits are on a average, if you take 5 years is normal, and after that it becomes an abnormal thing. What are the things the parents will notice generally? What are the changes that they'll notice in their child that should alarm them that they should take their child to the dentist for a checkup?
No, they won't be able to notice anything about the malocclusion immediately after the from 5 to 6. Once the habit continues after the age of 6 years, right? If for 7 years, 8 years, what happens? The upper front teeth will start, moving forward, which in turn not only causes the teeth to move, the upper jaw itself moves forward. It's it's called as a skeletal problem. So that will give that's called as proclamation of upper teeth. That is one. And because of the thumb sucking, what happens when the child keeps the thumb inside the mouth? So the this part will be pushing the upper teeth forward, and the down part will be pressing the lower teeth
Back.
inwards, right? So that will again give problems to that. Later on, the bite will be different. And another important factor is open bite. Okay, when we close the mouth, see for everybody, the upper and lower teeth will be like this, right? The upper teeth will be like this, lower teeth will be. So for the patient with severe thumb sucking or mouth breathing, the upper and lower teeth, the front teeth will not close when you bite. So
Hmm.
because of that, what happens is there will be pronunciation problem. The child cannot pronounce properly because unless the teeth are joined, the tongue meets the back, then only the pronunciation will be sharp. If there is an open bite, the pronunciation is not possible. And there will be proclamation, and the upper jaw will be proclined, lower jaw also will be proclined. So these are the symptoms that we can see develop over a period of time. So this, if we can notice earlier, before the growth stops, okay, say at the age of 15, 14, 15, the growth will stop. Before that, if they bring the patient, then we can control and correct the malnutrition.
So, if you're saying we can control and rectify this during the growth phase, what exactly does that mean? Why should
During
parents
the
consider this to be an important phase?
Because usually people think that orthodontic treatment, we go for braces or any type of clip, whatever it is. They say you got to wait for all the baby tooth to fall
All.
down, and then the permanent teeth to come down, and then only have to go and see the doctor. It is not so, because sometimes at that time, it will be already 15 years. When there is any growth related problem, as I said, if there is only a dental a problem concerning with the teeth, we can correct at any age. But when there is a problem concerned with the jaws, say upper jaw is maxilla, lower jaw is mandible, any problem with the jaws, then we cannot control once the growth stops, right? Then they have to either wait for about 20 years and then go for a surgical correction. The child has to go through all this, the teenage without with
Yes.
all these problems. So to avoid all those things, we see anything which parents notice anything if it is forward, anything. It is nothing wrong in taking the child for a consultation. Okay, then the doctor will be able to give them the better advice.
Yes, sir. Sir, so if you're saying that during this growth phase, there is some amount of treatment that can be done to rectify the problem, or possibly even rectify any malocclusion that is happening. What are the type of treatment options that will be available, sir?
Yeah, it's okay. There are different types of appliances that is available. So usually for thumb sucking, for example, so initially even the elders in the house, they themselves they will apply some unpleasant thing on the thumb so that the child doesn't. It's a good thing they do,
Yes,
but
yes,
some childs are very persistent. They all those things they will just wash it away and then they'll start sucking. It's a matter of insecurity. That's why they feel that the thumb sucking they feel very secure. So in order to avoid that, you have to go for a orthodontic correction, orthodontic appliance. It's called as habit breaking appliances. So there are different types of habit breaking appliances according to the habits. For
yes.
thumb sucking, we usually give a Holly appliance. There will be a plate inside and the wire outside. But there will be a crib inside the plate. So what happens? There will be a crib will be projecting. So when the child tries to put the thumb inside, the crib it will touch the crib, so it won't go inside. So thereby the child will avoid that habit. Next one is the tongue thrusting. That is, some child will be thrusting the tongue forward. Okay,
Yes.
every time. So that will also lead to open bite. So for that, what will happen? We will keep spikes, uh, something like not very sharp, some sharp spikes.
Yes.
Yeah, so that some when the tongue try to come, it will touch the spikes and then it will go back. So
Like
the
a
tongue
reminder.
try to yes, reminder. So it will try to adopt inside the oral cavity. So the tongue thrusting habit will be avoided. And another thing is called mouth breathing. Mouth breathing is very important to be considered because mouth breathing is a condition where the children breathe through the mouth. Usually, we have to breathe through the nose. The children breathe through the mouth. So before we start any treatment, we have to find out what is the reason, whether it is habitual or any other medical problem. Some child, because this is called the nasal septum, when there is a deviation of the nasal septum, they won't be able to breathe
Normally.
nicely, normally over through the nose. So they find more comfortable breathing through the mouth. That's why they have a pathological condition, tonsils. When the tonsils are enlarged, the adenoids are enlarged, eventually the child will breathe through the mouth. So we have to rectify, if rule out all those anatomical, physiological, pathological issues. If only habitual, then we can do by orthodontic correction. Okay. So for mouth breathing, we have a training appliance. It's called a oral screen or vestibular screen. It's like a shield that mouth. So what happens is the child, when try to breathe through the mouth, cannot breathe. So slowly, the child will develop breathe through the nose.
Nose.
So that's why the habit will be slowly eliminated. So these are all the certain habit breaking appliance we usually do for elimination of these habits.
So that means to say, sir, it's really important that parents take their child probably for a first orthodontic checkup at 5 years, so that if there is any signs that the orthodontic.
Not necessarily. I won't say 5 years. At least 6, 7 years. It's better to see once the the permanent teeth starts erupting. At least that time, 6 to 7 is the first lower teeth molars starts going to erupt. The ideal age. So at least 6 to 7 years, it would be the ideal age to get the child to for a consultation if at all they notice something wrong.
So even otherwise, it would be a good age to do a checkup for the child, just to see if everything is going normally in terms of the job.
Yes. I mean, normal checkup, yes, definitely it is not. It is not because checkup is not only concerned with orthodontic treatment. There are other issues, with dental caries. There are other, there are so many other issues that can be avoided if they can take the child for early checkup. Always earlier the better. Prevention is better than cure. These are the things are always there.
Yes.
So earlier always better. As I say, it's nothing wrong. We are not going to do any treatment. Nothing wrong in going for a consultation.
In evaluation.
We are so that we are sure that our child is in a good condition. That's the thing. The teeth are in good condition.
Yes. To prevent a lot of discomfort for the child during the later years, as the child grows older. Yes, because he becomes socially conscious. So it's better to rectify it if there is any problem at an earlier age, so that the child's teenage years would be a lot more comfortable, and he'll be a lot more confident in that sense.
True. Because nowadays the eating habits is so much changed compared to earlier days. The lot of eatables available, so child are they eat all this junk foods, but you cannot avoid them. It's like so you give them that, and then you take them for consultation. We are here to treat them.
Yes, sir. So that was indeed a very helpful talk about how oral habits. Some of the oral habits probably parents don't even sometimes think it's important, or they think with time it will become all right, so let's not bother. So I think this is a very insightful talk that you did say, and at what time they have to take their child for a checkup. And I hope our patients and viewers, whoever watch this program, will be benefited with this information.
I hope so, because I selected this particular topic, habits, is because I have been in this practice for so many years, and so many of my patients coming with this type of problem. The parents always they say, no, we were told we have to take the child after 14 years or 15 years. That is not correct. I just want to emphasize at that point. Always earlier the better. That's the only thing, important thing.
So, sir, thank you so much for joining me today in today's topic, and telling our patients your valuable experience on orthodontic growth and development, especially in children.
Yeah, it's been a pleasure. Whatever I wanted to share, I thought it will be useful to the patients. So, looking forward to have more discussions with you. With different topics.
I really hope, sir, you will be able to, from your busy schedule, you will be able to take some time off to share with our patients more of your experience in the field of orthodontics.
Sure. I would love to.
Sure, sir.
Love to. Thank you so much.
Thank you so much.
All the best to you.
Yes, sir. Thank you. So viewers, that was Dr. Prithiviraj, who did share with us his experience about jaw and growth development in children, and how you can prevent a lot of jaw growth discrepancies that if you notice in your child, by taking him for an early checkup to your orthodontist. I hope that talk was helpful. If you have any doubts or queries, please do leave your concerns below in the description box and in the comment section below, and we will get back to you. And if you would like to get in touch with Dr. Prithiviraj, his contact details are given below in the description box. So until next time that I come back with another dentist with another topic on your oral and dental health, please stay safe, be happy, and keep smiling. Thank you.